Curious about the causes of your bad breath and simple ways to manage it? As a dentist, I am here to guide you through the effective solution. Hey everyone, I am your super dentist and welcome back to my channel. Today we are going to talk about a common concern that brings a lot of people to my clinic, that is bad breath or halitosis. The primary cause of the bad breath in over 90% of the cases isn't our stomach, it's right here in our mouth. The main culprit is the bacteria that is living on the surface of the tongue in between the teeth or just below the gum line. Now these bacteria break down the food particles or dead cells, releasing the foul smelling volatile sulfur compounds. Now these VSCs are the ones that causes unpleasant odor. What are the causes behind the bad breath? Number 1, poor oral hygiene. Not brushing and flossing thoroughly can allow these food debris to be trapped in between the teeth, feeding these bacteria. Number 2, coated tongue. The surface of the tongue is usually rough and can act like a real estate for these odor causing bacteria. Especially there can be yellowish or whitish patch which acts as a major source. Number 3, gum diseases. So when the gums are swollen or if there is a pocket in between the teeth and the gums, that can act as a reservoir where the bacteria can thrive and are difficult to clean. Number 4 is dry mouth or xerostomia. Our saliva acts like a natural cleanser. In the absence of it, due to some medications or any medical condition or due to mouth breathing, then this will help the bacteria to thrive. Number 5 is smoking and tobacco. Tobacco by itself can have its own bad smell, but it can also lead to dryness of the mouth and contribute to the gum diseases. Number 6, decayed teeth. Now decayed teeth can trap food, or in worst case scenarios if it gets infected, that also can lead to the bad odor or bad smell. Number 7 is the medical conditions. Less commonly, the bad breath can also be a symptom for the underlying systemic diseases. It can be due to sinus infections, throat infections like tonsillitis or pharyngitis, or it can be due to gastric issues, gastric reflux diseases called GERD, or it can be because of diabetes or liver or kidney diseases. Fortunately, many strategies can combat bad breath right at home, focusing on good oral hygiene practices and promoting a healthy oral environment. So let's look into the effective home remedies. Number 1, proper brushing and flossing technique. It is very important that we brush twice daily for at least 2 minutes and floss at least once a day. Now this will reduce the number of bacteria or the quantity of bacteria that is present on the surface of the teeth. Number 2, tongue cleaning. Now this is non-negotiable. It is very important that we clean the surface of the tongue using a dedicated tongue scraper, or we can use the back side of the toothbrush, which is usually rough, to clean the tongue surface. Now as this surface carries most number of bacteria, it will help in reducing the bacterial load. Number 3, staying hydrated. It is important that we drink 2 to 3 liters of water every day. It will help in increasing salivation and also rinse away all the food debris that is present in the mouth. Number 4 is mouth rinsing. Using mouthwashes like chlorhexidine can give you fresh breath on a temporary basis, but it is not recommended to be used for a long-term basis. And especially alcohol based mouthwash should be avoided as it can cause dry mouth. But according to the research, the best mouthwash that you can have is a plain water. Number 4 is chewing sugar free gums, that is xylitol based gums. Now chewing sugar free gums will stimulate saliva production, which will eventually help in cleansing away the debris that is present in the mouth. It is a temporary fix, but it's very effective. Number 6 is dietary adjustments. Eating crunchy fruits and vegetables like apple, cucumber, carrot or celery can help in cleaning the surface of the teeth. It can act like a mild natural abrasive which will help in removing the plaque. Then having green tea. It is known to have polyphenols which is very effective in reducing the load of bacteria in the oral cavity. And finally, reducing the intake of sulfur containing foods like garlic and onion can help in reducing the bad breath temporarily. Though these home remedies are very effective in managing the malodor, they are not the substitute for the professional diagnosis. If the bad breath is chronic and continuous, then it is time to visit your dentist. The dentist will look into your oral cavity and see for the signs of any gum diseases or tooth infection or your poor oral hygiene. If the oral cause isn't found, then dentist will refer you to a physician who will investigate into the underlying medical conditions. Bad breath doesn't have to be a constant worry. By maintaining a persistent and thorough oral hygiene practices and staying hydrated and being mindful of your diet, you can significantly improve your breath. Remember, your mouth is a gateway to your overall health. If you found this video helpful, please share it with your friends and do not forget to like and subscribe. Thank you for watching. See you in the next one.